find such a love at our age. Whoever thought we could dance?
Welcome to Couples Therapy in 7 Words. I'm your co-host, Judy Alexander, and I'm here with my husband, Dr. Bruce Chalmer.
Hello, Judy. Hello, viewers and listeners. Judy, what's our topic for today?
4 things your therapist wants you to know.
Yes, and I just want to say right from the very start, that is a title ripped from the headline. Ripped from the headline of a New York Times article by Christina Caron, which we are just going to comment on. So if those of you who happen to have seen it in the Times are saying, wait a minute, they stole that? We absolutely stole that.
We absolutely did. Well, I said it was 4 things your therapist wants you to know before you start therapy.
Before you start therapy.
Right.
And I did shorten that thinking, no, we're going to talk more about that. And, we'll maybe agree with her some and disagree with her some. Anyway, it just seemed, it was your idea, actually. You noticed it.
Well, because
Yeah.
I know you and I have had many discussions about that, and it's in your book, and we've talked to other people about it, and then probably other therapists about it. So I thought it was a pretty timely article, and I thought I would get your take on it to see if you agree or disagree, and what your comments are.
Indeed. So we will do that in just a moment. We can be kind of brief about this. You mentioned, I've included that in my book, actually in several different books, different
That's right.
aspects of it. Let's just mention the names of our books briefly.
Okay.
Actually,
well, I think the one
you've
that
got them there,
it's
yeah.
in specifically, right? It's not about communication. Is that the one? What everything you always wanted to know about couples therapy?
No. Well, everything you know about couples therapy is wrong.
Thank you.
How ironic that you get that particular subtitle wrong, which I think is perfectly in keeping with the book. I do talk about it in there.
Yeah,
Yes.
I remember specifically that you do talk about that in the book.
I do.
Mm-hmm.
I talk about that in that book. And I have bits and pieces of my other 2 books. Reigniting the Spark is one, and Betrayal and Forgiveness is the other. You can hold
Right,
those up
since
while
you
we're
mentioned
talking.
reigniting the spark, why stable relationships lose intimacy and how to get it back, and then
Most recent one.
the betrayal and forgiveness, how to navigate the turmoil and learn to trust again.
Yeah. And I have bits and pieces in there about some of these topics, so we will be touching on that.
Right.
And of course, before we leave the topic of books produced by the likes of us, let's mention your book.
Okay, let's mention that one, The Blue Tent, Erotic Tales from the Bible by Laria Zilber. And that is Erotic Tales from the Bible. Just
By
what the
Laria
title
Zilber.
says.
And who's Laria Zilber?
Laria
You
Zilber,
are.
my nom de
Le
plume.
nom de plume, yes. So let's dive into this topic.
Okay.
So maybe what we can do is kind of follow along. She mentioned 4 things.
Right,
That's
4
what her
things.
article's about.
Okay.
Let's talk about each one of the 4 things. Shall we do that?
Sure. So
Okay.
I believe the first one that she mentioned was a strong bond is essential.
Yes.
So
And that one, absolutely. And of course, what she does, she quotes several experts, different therapists and academics and stuff, and really everybody, all of us are channeling. Such research has been done on what do people say seems to be the most important factor, or what are the most important factors in determining if people say the therapy they did was helpful for them, or they liked it, or they got what they wanted, or something. There's a lot of different ways of asking that question. But overwhelmingly, what's interesting about it, I always love to point this out, it doesn't matter what school of thought the therapist comes from.
right.
It's not, you don't go looking for somebody who is specifically psychodynamic or specifically,
CBT
or CBT, which is
narrative
everybody does
or-
CBT, or narrative, or even behaviorists. Although most grown-ups don't willingly go to behaviorists.
Jungian, Freudian,
All
of
of
the above.
Those
right.
are all interesting. They all have what to offer. That's not what determines whether it's good for you or
Right.
not. It needs to be, and she points this out in the article, it needs to be a good fit. What do you mean by a good fit? I don't know. You try it out and you discover that this person, the therapist, really seems to be connecting with you, which is to say they really seem to respect you, care about you. Doesn't mean they're going to agree with you, and that's another thing she points out in there. It's not
Right.
like you want the therapist to be an echo chamber.
Right.
But that's what a strong bond is. This feeling that, okay, this is someone I can talk to and feel able to talk to and still feel respected.
And one of the things that I like that she said that you should get the feeling that you're not secretly being judged.
Yes, absolutely.
So that you
And-
can let your hair down.
Yeah, and that's an interesting one because this is something that I've commented on in talking with other therapists and when I've done supervision and when I've done trainings. The notes that a therapist takes, one of the things that I say in my intro speech to folks, my little intro confidentiality speech, and I write about all this in that book, It's Not About Communication. One of the things I say in there is I take notes. I used to say, they could see me taking notes in the office. Now I do telehealth. I'm clattering away on my keyboard. I'm saying, look, what I'm doing when I do that, I'm entering a note. If you are ever curious what's in the notes, you get to look. No one else gets to look at that without your permission, except if there's a court order, which is a very rare circumstance. So that's what I tell people. And by saying that, I'm not just saying that, I really mean it. Almost nobody has ever wanted to. Every once in a while, somebody needs notes for some other purpose. They're going to another therapist or they're
Right.
for whatever reason, and they're welcome to it. The point there is, I am not afraid of anybody who's entitled to see it, seeing my notes. I'm not afraid of any of my clients seeing the notes
Right,
I put
because
down.
you're basically putting down the points that they're talking about. You're not putting down judgments.
I am not. I'm putting down whatever I think is useful to put down. Now, I don't engage in diagnosis, or very rarely engage in any sort of diagnosis. But even if I were, and back in the days when I was using insurance and I had to assign a diagnosis, I would nevertheless never worry about them seeing it because I wasn't thinking anything that, at least in my view, was disrespectful. I'm not saying that anybody looking at the notes would be just, delighted with what they see. I'm just saying I am not ashamed to show it. I'm not afraid to show it because I'm not thinking something I wouldn't want them to know I'm thinking. And I think that's the important part. It's not merely that I'm not writing down anything I wouldn't want them to see. It's that I'm endeavoring at least not to think anything I wouldn't want them to hear about.
Yeah.
Now, is that 100% all the time true? Of course not. Do you know what I mean? Who knows what random thought. Every now and again I'll meet someone and I have a hard time liking them. Most of the folks I work with, I don't have a hard time liking, actually, even if they're very different from me. That's why I like doing this kind of work, especially with couples. It's like they can be difficult for each other, but I try to find something in everybody that just seems like, wow, I respect the struggle you're going through. It's like, wow,
Yeah.
we're all in this together. Every once in a while, though, I'll meet someone that's like difficult for me to like. And so, but and I don't usually sit there and say, wow, I don't like you. That would be sort of silly. And then, if I work with someone long enough, usually I find that, I can like the person. But I don't write anything down I wouldn't want them to see because I'm not thinking that. So that has everything to do with respect, that idea that you don't want to feel like you're being secretly judged.
Right.
Totally.
And one of the things she says, aside from that, is that you should know within 3 sessions if it's a good fit.
Yes.
If something feels off,
Yes.
this is not the therapist for you.
Yes, and moreover, another one of my shticks, as you know, that I write about, the very first question I ask people after my little confidentiality speech is, how will you know if this is helping? And that focuses them right from the start on recognizing they are the judge of that. And it's interesting with a couple because they often have two different opinions of that. But in any case, each individual there is empowered to judge that. That, by the way, includes me. If I think I'm not helping them, I will often bring that up. I will say, I'm not at all sure this is helping from my perspective. Tell me about that.
Yeah.
I will often focus that, or I will specifically ask, do you feel like this is helping?
Yeah.
Because that's what that tells people is, well, there's an opposite story, which a lot of therapists, maybe not consciously, but a lot of therapists project, which is you are here before the expert, and this is a difficult process. We're going to get into that shortly. It can be a very difficult process, but you have to subject yourself to this, and I'll let you know when I think you're done.
Yeah.
There's whole, one of the reasons I got out of doing psychodynamic therapy was there is more or less, I don't want to call it a rule, but more or less when you're doing that kind of therapy, the assumption is if a client, God forbid, says, gee, I think I don't need to come anymore, and the therapist hasn't already come up with that idea, obviously it's resistance. Obviously it's going to take you 6 months to work through that. And I think that is nonsense. And pernicious nonsense.
Yeah.
It's not just nonsense. It's disempowering nonsense. And I think people need to know right from the get-go. And, my other shtick around that is at the end of the session, I don't say, when would you like to meet again? I say, would you like to meet again?
Yeah.
Even if it's obvious in the conversation, we've referred to the fact we want to meet again, I still say, would you like to meet again? And that's part of that same idea.
Yeah. Yeah. So cut your losses early if you're not feeling comfortable with the
Yeah,
therapist.
Well, and also bring it up.
Yeah.
Which I think she points in there as well. Actually, we'll get to that when we get to her number 3. But yeah, bring it up, and that is so often the case. Folks won't say, "Well, something about this is making me uncomfortable," or "Something about this is bothering me," or "I don't like what you said," or whatever. And if you're willing to say that, it's gonna go. It could go better. I won't say it's going to. And if you're not willing to say that, it won't go better.
Right. Because you got to be able to trust your therapist.
You
If
do.
you don't, then what's the
Yeah.
point of seeing a therapist?
Yeah.
Right.
Exactly. Yeah.
Okay. Number 2. You might feel worse before you feel better.
Yes. That is true. And, I don't stress that when I'm working with couples. With couples, it's more like you'll probably feel a little better right away,
Yeah.
but don't be surprised if some of the old stuff still comes back. And what I'll often point out is when you do feel better right away, that's great, by the way. Long may it last. But often what happens when you start to feel better and then an old pattern recurs, you feel worse than you did before.
Yeah.
Because it feels like, oh no, not merely is this the same old damn thing that we didn't like already. It's like, I thought we were done with that. It's disappointing.
Yeah.
So, I've pointed out, some historian has pointed this out, I'm sure many have. Revolutions don't happen at the depth of despair. Revolutions happen when things start to get a little better. And the same thing in terms, I remember learning this little factoid when I studied for the psychology licensing exam 31 years ago, which was the statistic that says the most dangerous time for suicide isn't when someone's at the worst of their depression, it's when they start to come out of it. That has always jived with me with, that interesting phenomenon that when people start taking antidepressants sometimes, that brings on suicidality. I'm not sure how simple that relationship is, but that phenomenon that when it starts to feel better and you're starting to have hope and then it gets dashed because you still have some old patterns happening, that can be really painful. So indeed, you might feel worse in that sense before you feel better.
Right. So let's see. What are the things she says that what we often see on TV shows or hear on podcasts, therapy doesn't usually come with a dramatic revelation at the end of each session or a big aha moment. Rather, it's usually a series of small changes that add up over time. Is that what you see?
Oh, absolutely, yeah. Well, yeah, and then there's the phenomenon, of course, which is a classic among therapists, of the doorknob conversation.
Tell
the
me
doorknob comment.
Oh, when you're leaving.
They're about to leave. Oh, by the way, did I mention? Or by the way, and they'll say the thing that had they mentioned early in the session you could have talked about. And I don't judge that harshly in the slightest. It's not a ploy. Do you know what I mean? It's like, yep, it comes up when it needs to come up. Sometimes it comes up when you've just had a good session.
Yeah.
Things start
then
to
it jogs the memory, or jogs not just memory, but it brings up something that you might have been thinking about but suppressed.
Yeah,
and,
or are
and then
willing
it
to
comes
say.
the surface. Right.
You're feeling safe enough that now I
Right.
say, wow, you know what? Now I can think this. Now I can say this.
Yeah.
It's not an unusual thing. So,
I never liked your mother. I love your mother, by the way.
Yes,
But
I know, that sort of thing. Well, or,
yes, but
by the way, I'm having an affair.
you don't want that as the doorknob moment.
I think I will throw this one at that about, by the way, I'm having an affair. I work with couples, right?
Right.
I think I've said this before. In 30 years of doing this, there's only been one time when that bomb was dropped in the session.
Yeah.
Every other time I've worked with, a substantial proportion of the couples I work with, there has been infidelity, so that's not unusual. But almost always, except for that one time, both parties knew about it before they came in for that session. And it's only been one time when somebody came in and I ask about it routinely. If they haven't mentioned it, I ask about it routinely. One of the first few questions I ask, any infidelity, any substance abuse, just because it's useful to get that stuff on the table. And only one time I said, any infidelity? And the wife said, no, of course not. And the husband said, well, and
oops.
Yeah. And I generally, and those rare occasions when somebody has asked me, do you think it's a good idea? You know, sometimes before the first session,
Right.
they'll say, should I tell her? Should I tell him? You know, about an affair? And as usual, I don't tell them definitively what to do or not. But what I typically say is, it's usually a better use of the therapy time if you've already told them,
Yeah.
because going into shock isn't going to be all that helpful in therapy.
Yeah.
So there's that.
Okay, number 3, you have agency.
Yes, exactly.
Yes, so that it's a collaborative process, not a lopsided power dynamic where you do whatever the therapist says.
Yeah, exactly.
Right?
Yes, that's what you're quoting from her
Quoting
article.
from Caron's article,
Yes.
right?
Yeah, and I totally agree with that. It is indeed. In fact, that's one of the words. Collaborative is one of the words I've used when I describe how I work. I'm active, respectful, and collaborative.
Yeah.
And each of those words means something. Active means I don't just sit there like, it's funny, early on in my practice, I would get people, this is back in the days when people would make appointments by phone. Remember phones, folks? You know, phones that went to an office, not a person. You know, it was kind of amazing.
One ring you didn't.
Exactly. So I would answer the phone, and someone would, be wanting to set up an appointment, and they would say, "Do you talk?"
Uh-huh.
And at first, we're talking on the phone, so clearly they're not asking if I am, mute or unable to create sound. But it took me a while to figure out. Oh, I know what you mean. Are you one of those therapists that just sits there and says, "Uh-huh"?
Right. While they're lying on the couch doing all the talking,
Free associating.
and every 10 minutes you go,
Yeah, exactly. Right. And occasionally, every once in a while, maybe once in a session, drop in what in psychodynamic terms they refer to as an interpretation. God forbid you should actually ask a direct question. You don't do that.
Yeah.
So, yeah. So
Which is not what
I do
Caron
not-
is saying in this article
Not
all.
at all.
And not the way you work either.
And that's the point. And that when they're asking, do you talk? I realize, oh yeah, absolutely, I talk a lot, as you know, as viewers and listeners of this podcast know as well. Even in sessions, though, I'll contribute whatever I can contribute. But what I contribute is coming from that really radical sense of respect. I genuinely do not think I know better than the folks I work with how they should live their lives. I
Right.
genuinely don't think that. Even when they are screwing up royally, of course, don't we all screw up on occasion? Usually, when people are in my office, some things have gone badly, or they wouldn't be there.
Right.
And some of the times the things have gone badly because they've made mistakes, welcome to humanity. I don't judge that harshly. I am not thinking, oh, I know better than you. What's the matter with you? It is respectful. And collaborative is the third thing I often say, as she's pointing out, because we're in it together for the benefit of the people I'm working with. And it's interesting when you're working with a couple, and she wasn't really talking about couples work here. She was talking about individual work. When you're working with a couple, collaborative is fascinating because you have two different people you're working with
Right.
who may have very different views of what they want to have happen.
Yeah.
And indeed, I think she mentions goal. Yes, that's right in that article. So it's important to work with your therapist on setting goals and finding ways to measure success. And that one, the finding ways to measure success, I focus people on, as I said earlier, from moment one. It's like, yep, how will you know if this is helping? Where I differ from a lot of therapists is the idea of setting goals and even the idea of measuring success. And I'm an old statistician, I'm an old research guy. I know about doing measures and, outcome measures and trying to figure out if things are effective. You have to have some. In fact, my master's thesis in statistics was on measuring quality of life in patients with advanced cancer, because I knew there had to be some way to do that if you're going to evaluate. I was working for a project that was evaluating whether nurse home visits improved quality of life. Well, you better find some way of measuring quality of life to answer that question statistically.
Yeah.
So I have all kinds of respect for efforts to do that. What's interesting when you're working with folks in a therapy context is that isn't static. And not only isn't it static, I don't think it should be static. That changes. I don't know how to define, what are our goals for this conversation? What are our goals for this podcast? I don't know. We went in thinking one thing and keeps on. It is what it is as it goes.
Yeah.
And that's what therapy is. And so I don't say you should write down your goals. I don't go back and say, well, this is what you said then. Now what do you think? Occasionally I'll do that, like the first session, this is what you were saying. But
It's
most
not like a runner who can chart how they're doing today, and if when they've eaten something and how
Right.
it makes their body feel. So
Right.
it's very different. It's a whole-
Yeah, and there's a guy named Scott Miller who's an interesting guy. I haven't met him personally, but he's well known among therapists. Who's a great proponent of asking a few simple questions at the end of each session, getting a numerical rating from the client, and I respect his research. He's pointed out all the ways in which this can, first of all, identify when you're not being effective. It can help you make it more effective. I have great respect for all of that. I don't work that way because I don't want to imply that those numbers are the story. And, maybe this is just a thing about me, when I go titling books like Why Everything You Know About Couples Therapy is Wrong, as I point out, that applies to me too. I'm very leery in therapy contexts of insisting that things are static, because that is not how life works. And there's something about that just goes against the grain for me.
Yeah.
So it's not that I don't want people to come in with a sense of, is this helping? Would never assume it's helping.
Mm-hmm.
You need to be on top of that, but exactly how you're evaluating that's going to change from moment to moment, and you have to be comfortable with that degree of fluidity.
But don't you think sometimes people come to therapists because they want to be told what to do?
I think that's true sometimes. So, or at least it's funny. I had to be working for a while. As I've gotten older and more mature in my work, I am no longer distressed at the notion that people are coming to me as an expert thinking maybe I have some good ideas to offer. You know what I mean? Early on, it's like, no, I'm only about the process. No, maybe I have some good ideas. I'll throw them out there if they're worthy. What I won't do is tell people what to do with the implication that if they don't do it, they're stupid. And there are ways of working where that's kind of what you're doing. And I don't like those ways of working. And look, but there are folks who do fine with that. So, chacun a son goût. I wonder what the thing that provides the captions for these videos will do with chacun a son goût, but we'll figure that out.
We'll find out.
See if it figures out French. That was French bots that are figuring this out. Yeah.
Okay, and our number 4, her number 4, Christina Caron. Therapy is not a sign of weakness.
Yes.
Seeing a therapist doesn't mean that you're fragile or that other people have it all figured out and you don't. It simply means that you're taking a step toward bettering yourself.
Yeah, that is true. Absolutely true. It is not. Of course, it is a sign, usually, that something hurts.
Yes.
And there are folks, and I've heard this expressed by numbers of people over the years, people will come in, again, I work now mostly with couples, but even before when I was working a lot with individuals too, people will come in and say, well, everybody should always be in therapy. And there are folks who like to work that way, who like to say, yeah, it's part of your health routine. You go and talk to your therapist once a week and and how can I put this? Well, I don't have to be delicate. This is a podcast, not a therapy session. To me, that's bullshit. It's like, no. Let's just put it that way. I don't like working with that sort of thing. I want to help people deal with things that are hurting them. Of course, I want to help them feel better. Right. And I have enormous patience. I don't always assume that they can right away, certainly. I don't always assume that that the level they're trying to get to is even attainable. I hope it is. We try for it. So it's not like I'll write someone off if they keep suffering. Oh my God, I'll stay with people, But the idea that says that therapy is just there as a way of sort of doing navel gazing, I just don't want to work with that. It doesn't,
I think not only hurting, but I think sometimes people want to go to therapy because they don't want to repeat certain patterns. And they see themselves repeating certain patterns in whether it's parenting or relationships with partners or relationships with parents or things at work. So don't you find that true?
Oh, totally. Yeah, and that's a lot of the work is often developing new ways. I say understanding. It sounds so cognitive. It's more than cognitive. It's also emotional. Developing new ways of understanding, reacting to stuff that you've been reacting to without a lot of thought, in such a way that then you realize, oh, I do have agency. I actually have some power here I didn't recognize. And that can be empowering. That feels really good. It's like, oh, I actually have some options it didn't even occur to me to consider.
Sure.
And that's a really useful thing. The flip side of that problem, though, is the folks who use therapy instead of changing.
Ah.
I've encountered that as well. Far less with couples therapy, actually, than I used to with individual therapy. Yeah, with individual therapy, there was the occasional person who was only coming to individual therapy so they could tell their prescriber, usually prescribing opioids in those days, that they were seeing a therapist. And they had absolutely no intention of getting off the drugs. And that was just a way of maintaining their addiction. And not a lot of people, but there were a handful of people I worked with over the years where that was the case. There certainly were people I worked with where it seemed to me the effect of therapy was to keep them stuck instead of getting them unstuck. Or maybe just the effect of therapy with me. I wasn't helping them a lot. I certainly would encounter that as well. I've had the occasional couple where that's true, where they'll keep seeing me, and it's almost like they keep seeing me instead of making the changes they need to make. Because at least they have in the back of their minds, well, we are talking about it, so I guess that means we're doing something about it. And, it's always it's a delicate balance there. Because I don't want to facilitate that because it's not helping. On the other hand, you can't always tell. So, part of what makes it exciting to do this work is that bit about you can't always tell. It's like a thrill ride in some ways with a lot of important and even sacred stuff going on. And you don't have total control over it. None of the people involved, none of the three of us, the couple and me, have total control over it. And I'm trying to do the best I can to kind of make it so that it'll go in a good direction.
Right. We've talked about therapy as improv, right?
Yeah, absolutely.
When you go to a good improv show and everybody's, clicking on all cylinders, you don't know where it's going to go.
And of course,
that makes it exciting.
That's what makes it exciting. And of course, the actors don't.
Right.
That's the exciting part. The actors have no clue where it's going to go. And since you mentioned improv, we'll talk about the basic rule of improv, which is
yes and.
Yes and. And I try to do that in our conversations. Do you know that? It's like, yeah, and I think we do that. It's
I
like,
think we do.
Yes and. It's you go with it and you add something, and where you're going to go, you don't know because you don't know how the other person's going to, what they're going to add. And when therapy is like that, and I did write about that, and it's not about communication. When therapy is like improv, it can be really, just like an improv show can be hilarious. Well, I'm not talking about hilarity in therapy usually, although sometimes it is funny. Sometimes we laugh, but it's incredibly meaningful. It is generative. It feels alive.
Yeah.
And that yes and thing, and I've often pointed this out, I come to the session in yes and mode. Typically, the couple comes to the session in no damn it mode.
Right.
Exactly. That whatever the other one is saying, no damn it. And I don't mean that in any sort of I hope any sort of condescending way. I mean, it's like, yeah, that's kind of where people are at. They're in pain. They're protecting themselves.
Right.
They're feeling hurt by someone that the last person in the world they want to hurt them. And yet they're feeling hurt and they feel bad about hurting the other person, usually. And so they're not in yes and mode. And to be able to get the conversation into yes and mode, it starts to come alive. And that's when people are able. And look, there's some very, I think, very funny outcomes. Again, some of which I've written about in my books. The one where one of my favorite ones, the one where they came in to a session after a few sessions with me, and they watched one of our podcasts. And they came in, and the guy said, and they're both smiling, they're both beaming. The woman too, mind you, when you hear what I say, the man said, and the man said, well, we watched your podcast, we thought more about what we've been talking about in session, and I realized something. I do think she's a moron. She's smiling, she's laughing. You'd think she would be looking like urged to kill. Au contraire. Because he's smiling, because he's realizing he's been the idiot by thinking she's a moron. He knows she's not a moron. He already knew she wasn't a moron, but he realized he was treating her that way. It wasn't that she was oversensitive. It's that he actually did think that he knew better than her about everything. And once we were able to challenge that, and I didn't challenge it by saying, oh, you're being a jerk. We were able to talk about those tendencies. It's like,
and that's where the give and take part comes.
Exactly.
And being able to talk to your therapists about that. And
And they came in. Now, so why is she smiling? You could say, well, she's smiling because he's after all, realize this thing about her that she's wanted him to realize for a long time.
Right.
But look, there's plenty of women in that circumstance that are not smiling. They're pissed because they're saying, oh, great. So you go to a therapy session with this guy and you hear it from him, and now all of a sudden you're believing me. And she still wants to kill him, you know. And yet she's smiling because she said, you know, I realized I agreed with him. I thought I was a moron too. And she
Because
had
he
to,
undermined her confidence so much.
he and everybody she'd grown up with.
Yeah.
In other words, she was prone to that already.
Right.
He was just, and look, he wasn't a terrible guy
No,
at all.
but you know, it was that pattern.
Yeah. And so she was participating in it as much as he was. And when she realized, oh, and then, you know, and it came up, I remember in the previous conversations it had come up, it's like, so wait a minute. So, you know, tell me more about your graduate education. You know, tell me more about all the ways that indicate by anybody's measures that you're obviously a very smart person, you know. And you know, they both knew that already, but there was something about it that she was able to say, oh, wait a second. We're just regular people here, aren't we? You know what I mean? I'm not a moron. And when he talks to me that way, I get pissed because she's condescending to me. And he realized it. And the beautiful thing about that, among the beautiful things about that, once they realize that, it's funny. It frees them both because it means she can say whatever she damn well wants. I mean, you know, because she's not going to be mad at him.
Right.
So she can say what she wants. She can disagree. She can agree. You know, she's free to agree with his suggestion when it was different from hers. You know what I mean? She's free to give in without feeling like she's given up her dignity.
Right.
Because she feels fine about herself. And moreover, he's free to disagree with her without feeling like he's putting her down because he is in fact not putting her down. He's not disagreeing with her in a way that puts her down. He's disagreeing with her in a way that says, I'm not sure I agree with you.
Yeah.
You know, as opposed to just saying,
as opposed to telling her, you know, that's a stupid thing for you to say, and
right.
You know, I know better.
Right, exactly. And you know, he was never saying that's a stupid thing. He was never
but he made her feel that way.
But he thought that. Yes.
Yes, he thought that.
He was thinking, oh, there she goes again. You know, and as opposed to, hey, I don't think I agree with you. Tell me. He was genuinely curious. Tell me why you think that. And so she could convince him, or she could not convince him, and it was fine for both of them. They showed up as grown-ups instead of her feeling like she was, you know, the kid and he was the
and
he was dad.
She didn't have to get pissed off at him all the time and resent his put-downs.
And all the research that you see, I'm thinking John Gottman's research especially. Look it up, folks, if you're not familiar with it. All of his research that talks about how couples work and you know how. The soft start up from the woman, you know what I mean? She's not already pissed. When she's not already pissed, it seems to go better. Well, of course. And when is she not already pissed? When he's not condescending, you know, when he's actually listening to her, when he's actually accepting influence from her. Those things fit together so well. All of that fits those stories. When you can do that with a couple with respect, then life takes off. You know, then things can go well. So, you know, it's funny, when we went into this conversation, I was thinking, well, I'm going to agree with some stuff and disagree with some stuff, but mostly I agree with everything in the article. I quibble a little bit on goals, you know.
Yeah.
But no, I think it was generally a good article.
Although she does end the article with saying that, that when, let me find it. Yes, I found a psychologist who helped me work toward specific goals, and when our time together ended, it was akin to graduation.
Yeah, and I totally respect that. It's like, no, good for you.
Yeah.
And that is true in a sense with couples. It's just the interesting thing, and I think with individuals too. I could ask the author there. I'll bet your goals shifted while you were working.
Although
and if
I was
they
going to
didn't,
say,
fine,
aren't like even if you're not setting specific goals, aren't there goals that are implied, such as you know, a couple's coming to you, they either want to keep this relationship together, B, want to break up this relationship, or C, want to find a way to work within the relationship where they're not always angry with each other.
Yeah.
So that might not be a goal that you're saying specifically, but it's implied in when they come to you. Yes. Yes
and no, because the bit about, you know, they will often come and say, well, you know, and I'll ask the question, do you want to stay together?
Yeah.
And they will often both say yes. Great. That doesn't always define the goal. Do you know what I mean? It's interesting. And so, and of course, often what I will elicit a little bit more about that, because it's not just that they want to stay together. They want to be happy about staying together.
Right.
They want to stay together.
Right.
In fact, that's also a theme that often comes up. If I ask, do you want to stay together, one or the other or both will say, well, not like now.
Right.
We want to get to a point where we both want to stay together.
Yeah.
Great. So that's sort of a goal. But often that goal shifts to, you know what, we're realizing we're not right for each other, but we do have kids. We want to be able to work together and be okay. And that's painful, but, and I don't, that's not my favorite outcome. But that's success. They wouldn't have known that going in.
Yeah.
And similarly, a couple staying together but being miserable and just realizing, well, there's nothing we can do. I don't call that a success. Maybe they do, but I don't count that as a success.
Well, there you have it. So if you are thinking about seeing a therapist, here are some things that you want to know before seeing one. And anything else you want to add to that?
Well, just note that in the session notes I keep saying session notes, therapist that I am. In the episode notes for this episode of our podcast, I will include, of course, a link to the New York Times article, and I will let the author know that we did this podcast in case she wants to look at it, and maybe we can have her on. I don't know if she'll want to be on our show or not. Although she was more quoting other experts rather than being an expert herself, but she had an interesting story to tell. So that's that. Yes, indeed. And how can people get in touch with us if they want to make such suggestions?
Okay, well, you can go to our website, ctn7.com. That's CT as in couples therapy, and the numeral 7.com.
ctn7.com. And we hope you will do that. And of course, we'll also hope that you will do a few things, folks. Here's what we ask of you. Rate us and review us and subscribe to us and, do all that. I'm putting in a special plug to review my latest book on Amazon, frankly, because that's where folks find out about it.
Right,
Betrayal and Forgiveness, How to Navigate the Turmoil and Learn to Trust Again. And I'm going to put in the episode notes a specific link that you can go to that will go right to the review section. And of course, you need to have read the book, or at least parts of the book, to be able to review it. So I hope you'll acquire the book. You can find out more about the book if you go to my website, brucechalmer.com. I'll also throw that in as well. I'll give you some links to where you might find more information about that book. And so until next time,
Remember, be kind
don't panic.
and have faith.